Dr. Pillay, North Lincolnshire CCG IT lead. In this video, we're going to look at the latest COVID-19 template by Primary Care IT for EMIS web users. Now, you would have heard from the earlier video I did this week about the frustrations that we did not have the codes for moderate or low risk patients of COVID-19, and that has now been rectified with the latest release of the templates from Primary Care Pathway. So in this example, let's assume that Mickey Mouse has wrongly been identified as COVID-19 high risk. So what we're going to do is we're going to go into the template, and that's OneRemote COVID-19 version 5. And it's worthwhile spending some time to acclimatize yourself to the new template that's been released, because there are lots of positive points on it. I'm just going to minimize the risk screen. So that front page, the first page that you come across is the COVID-19 NICE NG165 guidelines, and that's the most detailed template page available, and that just talks you through everything that you need to know at present with regards to COVID-19 and its assessment. But they've introduced a few new bits. So for example, if that's a bit too heavy for you, you can go into the quick COVID assessment, which just breaks it down into a bite-sized assessment. Once again, very useful, and it incorporates the NEWS2 score, the CRB65 score. I like this bit of here where it says it's more likely to be viral or bacterial. Sorry, I think I went a bit too fast. It's higher up here. So what makes it more viral cause? And you've got a drop down of different options. What makes it more likely to be bacterial? So it helps you with regards to your decision-making process. But here's the bit that's also useful and, relatively new. Now, this basically breaks down the risk stratification based on the CMO letter. So it's clearly there on a template for you with links to where you need to go. Yeah. And it breaks it down into high clinical risk group, moderate clinical risk group, low clinical risk group. So just to keep this video short, because there is actually a thorough and detailed video that Primary Care Pathway has released, I'm just going to focus on what we're meant to do with patients that have been wrongly coded as high risk. So once again, Mickey Mouse has been wrongly coded as high risk, and I've kept his name aside from the search I did at the beginning of the week. All I'm going to do now is I'm going to downgrade his risk, and I'm going to put him in this box which says low risk category for developing complications for COVID-19, and I can put down a reason here. So no clinical proof, if I can spell, that it affects unspell for the life way. Nice. Okay, now what's going to happen is as soon as I press the save template, you'll see that the COVID-19 high risk code is actually removed from the patient. And let's press save, and there we go, it's gone. So yeah, start using the template to deal with your day-to-day COVID-19 inquiries. A very useful part of the template that I've not covered is the advanced care planning, the end-of-life planning. Definitely spend some time looking at it.